Cardiovascular diseases claim more than 7 million lives per year and is the #1 killer in the world, but it doesn't have to be that way. Maintaining a healthy heart is not complicated, but unfortunately most of us have a hard time following the healthy lifestyle advice. We now have a drug to help improve overall cardiovascular health. Statins are used as a first line of therapy to lower high cholesterol levels to help prevent heart diseases. All cells require cholesterol to normally function. Lipoproteins such as low-density lipoproteins LDL and high-density lipoproteins HDL are responsible for the packaging and transporting of cholesterol through the blood. LDL is known as the bad cholesterol and HDL the good. Factors such as unhealthy diet can overload this essential pathway, resulting in the buildup of plaques in the arteries, constricting blood flow. Statins are lipid-lowering drugs that contribute to the inhibition of cholesterol production. Cholesterol synthesis begins in the liver, where 3 molecules of acetyl-CoA combine together to produce hydroxyl methyl-CoA, or HMG-CoA. HMG-CoA then reacts with HMG-CoA reductase to produce malvinate or malvanic acid. Malvinate undergoes subsequent transformations to form steroid precursors and ultimately cholesterol. Statins competitively bind to the active site of HMG-CoA reductase, which inhibits cholesterol production. The decrease in cholesterol concentration activates a cellular signaling cascade that terminates the activation of steroid-regulatory element binding protein, SREBP, a transcription factor that upregulates expression of the gene encoding the LDL receptor. Activation of SREBP by low cholesterol increases transcription of the LDL receptor gene, promoting the capture of excessive LDL to maintain cellular homeostasis. HDL levels are also increased and triglyceride levels are decreased. Benefits of taking statin drugs include increased HDL levels, decreased LDL levels, prevention of reoccurrence of heart disease and stroke, and decreased respiratory harm such as pneumonia and COPD. The most serious adverse effects associated with taking statins include fatigue, memory loss, nerve damage, myopathy, rhabdomyolysis, liver damage, sleep disorders, diabetes, and erectile dysfunction. There is widespread debate of whether statins are being overly used. Statins are amongst the top 10 prescribed drugs in Australia. Doctors are concerned with the widespread use of statins, as they not only deplete your liver's production of cholesterol, but also several other enzymes. Depletion of these enzymes causes a major side effect of fatigue. Inhibition of HMG-CoA reductase leads to the depletion of various essential molecules such as coenzyme Q10. Coenzyme Q10 provides the body with energy, making the heart work better. Coenzyme Q10 is an antioxidant that is produced in the liver and is involved in producing energy. Depletion of enzymes may also cause memory loss. However, some studies suggest they help with brain function in patients with dementia and Alzheimer's. This area further needs to be studied. Most of the side effects that arise from taking statins can be reversed once you stop taking the medication. However, it is important that you talk to the doctor before ceasing medication, especially if you have experienced previous heart problems. So what does the future hold? FDA has recently changed the labeling on statins, stating the complications that may arise while taking statins, such as liver dysfunction, acute kidney failure, cataracts, and muscle weakness. Statins are also being considered of potential future therapeutic value in rheumatoid arthritis. Studies conducted showed beneficial effects in lowering swollen joints, as well as increasing number of T cells that are responsible for inflammation in rheumatoid arthritis. Remember, the best way to keep your heart healthy is by maintaining a healthy diet and exercising on a regular basis. And the best part is, it's free!